dive into all the procedures that Dr. Malakov can do, and I wanted him to start with his favorite. Let's talk about what's your favorite periodontal treatment and why is that?
Well, I mean, I love every aspect of periodontics. I love implant placements, surgical sinus lift. I love getting the patients back into their oral health via if they need any kind of deep cleanings or osseous surgery. Gum grafting is another procedure that I enjoy doing as well. There's just there's not really one procedure that I love most, but the good thing is that I don't not like any of them. So that's the good thing. But let's talk about gum grafting.
Okay.
So a lot of patients come in. Some patients have where they see they have recession in one area. Some people come in, they have recessions generalized and there are multiple areas. So how recessions can come about is could be from brushing too hard, or it could be from attrition or malocclusion. So the gums tend to follow the bone. So if the bone starts to resorb or go down, the gum will follow suit with it. So some people can complain of increased sensitivity or discomfort. Some people just don't like the aesthetics of it and they want it to be covered up. So we could go about it to covering up via different ways. We could take some connective tissue from the palate and move it to the area that we would want to remove the recession, or we could use an outside source, which is known as, let's say, alloderm, which is a human skin cadaver, which looks like a piece of cardboard sponge. So we would, reflect the area, clean everything up, recontour how everything needs to be recontoured, and graft the area and try to remove the recession, try to cover it back up and try to achieve full coverage. Even if we don't achieve full coverage, at least we thicken the gum up to prevent it from getting worse.
Right.
You don't want to get it to a point where it gets too severe, because that means there's no bone attachment in that area and the tooth may need to come out, but hopefully it doesn't get that bad.
Yeah, that's a good point. I remember one of my girlfriends, the teeth started looking like horse teeth because the gum, she clenches and she was destroying the bone, because when you clench, the bone breaks down. So I said, you need to do something. And then she had ortho also, that complicates the matter. So when I reflected her gums, she had no bone on the roots. So obviously she needed more than gum grafting, but we were able to actually place a thick, gum grafting everywhere. And that, she still has teeth because of that. Because if you lose a bone and lose the gum and you have horse teeth, what are you gonna do, So I see that a lot. Like, people don't know that when they clench, the bone goes and the gum follows, but sometimes the bone is even further apart.
Yeah.
So what would you do with a case like that? Say she had like 10 millimeters of bone loss. Would you put bone after?
It also depends on the type of defects. Once we would reflect the area, we would see what kind of defect we had there. There's also a time where we could put outside, like allograft or different types of bone in the area, and then augment it with the gum graft on top of that. Also using different, we use PRGF or different types of stem cell factors to promote healing, but every case is different. So it all depends on, it's not one set way to do everybody. Every patient is its own.
Right, it's very unique, and each tooth also is unique, and each tooth has 6 surfaces, so they might all be different as well. So your specialty is very detailed, and people don't realize that the tooth is surrounded by 6 walls.
Yes.
Pretty much. So tell me about sinus lift.
Oh, sinus lift. So sinus lift is done on your upper jaw. It's usually when your top teeth in the back are removed, and it doesn't get grafted, or even if you do graft it, sometimes there's just not enough room to place an implant. We want a certain amount of distance of amount of bone to be in order to be able to place that implant. So if there isn't, we have to actually reflect the sinus, put a bone graft in there, which looks like salt, let it heal for a few months, and then attempt to put the implants in. So for example, if you have like this amount of bone and the implant's this long, you don't want half the implant to be in the air cavity. You'd want to do the bone sinus lift, so that way you have this amount of bone, and then you can put an implant in so it's fully encompassed in the bone. Otherwise, if it's half in the sinus, half in the bone, you're not getting that good stability.
It sounds like a construction. So if you're gonna put a column, you cannot put it on air.
Correct.
You have to have a foundation.
Yeah, and the instruments and the technology that we have today helps make that surgery go a lot more smoother. There's the tools that we use. I'm able to literally shave off. If you have an egg, I can shave off the top portion of the egg, the shell, and keep that whole membrane intact, which is like impossible to do if you like try to like remove it with your fingers or something like that.
He's good. That requires a lot of gentleness,
Yes.
and also art. You know, you really have to be good with your hands.
Yeah, and it's all you know, thanks to the faculty and the professors at NYU where I did my training.
Yeah.
We just did a great deal amount of them, and I got to learn them from not just from one person, but like 5, 6 different faculty and different techniques and ways
That's
to do it. So, and then I've done so many once I've been out of the program. That now it's kind of like second nature, thankfully.
Yeah, but he's good. He's good because he can have the best faculty, but if he doesn't have the hands, I was in dental school, and the top 2 people in the class, they didn't have the hands. So thank God they decided not to be clinicians, because you know they were very smart and they were very good at book stuff, but when they would touch something, it was like a disaster. So you are gifted. He's very humble. So I want to really acknowledge you, because you have gifted hands, and that is not given by the faculty. You know, they can teach you techniques, but you know, that's just like an anointing that God gave you. That you have that and you like it, because you know, that's very tedious for somebody that doesn't have the finesse with the hands. They cannot do that. All right?
Thank you.